Thank you so much for having me here today to talk about U equals U 5 years later. Where are we with this global movement in terms of the reach of U equals U? How far has this campaign actually gone from grassroots to global? And what is the impact of U equals U 5 years later? Really looking in terms of stigma and discrimination against people with HIV. What is the data saying, and what are people with HIV saying? So first, let's take a look at the reach of this campaign. It started with activists and a handful of researchers and has now gone from a very grassroots all the way up to the very top of the field of the most influential organizations that are endorsing U equals U. And I think it's important for everyone who's on this webinar today and beyond to know that these entities are really supporting the message of U equals U and encouraging all of us who work in the field to get this message out. So first, I'd just like to look at PEPFAR, arguably the most important entity in the global response to HIV, is requiring U equals U education of all 50 countries. I'll say that again, that is a minimum requirement of all 50 countries to educate about U equals U. And in their guidelines, PEPFAR has highlighted U equals U significantly in many sections. Here's just one of them. And they've underscored how important this message is to people with HIV and to the field. They call it revolutionary. And they've also really done a great job at highlighting the importance of U equals U for reducing stigma, aligning with our treatment goals for testing and treatment uptake and adherence, and also highlighting the really important point that U equals U is a public health rationale for access to healthcare. Because when people with HIV stay healthy, we not only thrive and stay alive, but we also can't pass on HIV. And that's a really important reason to make sure that all of us have the health and the treatment and care that we need. So the WHO, this is important because a lot of people don't know about this yet. This is a recent development as of July 2021, this summer. The WHO integrated U equals U clearly into its treatment guidelines in two places, one under prevention and other under service delivery. So this is particularly important for healthcare professionals and governments that look to the WHO for guidance on if and how to communicate U equals U to their patients and to those affected by HIV. So now this is absolutely official from the WHO. We must communicate this message and we need to communicate it clearly. We have the WHO backup. But even before the update to the 2021 guidelines, the WHO made a statement along with the Health Ministry of Thailand and UNAIDS supporting U equals U unequivocally. They actually said that they endorse U equals U, and they were encouraging people to raise awareness and promote knowledge of U equals U, underscoring the benefits of this to reduce stigma and in its alignment with our treatment goals. So again, it's really important that WHO is behind us and that everybody know that. And then I want to give a huge shout out to Brazil, one of the first countries in the world to officially integrate U equals U or I equals I into their treatment guidelines. So this was back in 2019. Shortly after that, the United States integrated U equals U into its official treatment guidelines, and the CDC released a statement strongly encouraging the field to communicate the U equals U science. Now, the CDC had already agreed with the science back in 2017, but this was the first time that they issued a really strong statement to the field that it's time to communicate this message, and you can use the U equals U phrase and terminology, and you should. More recently, Japan signed on and endorsed the U equals U message and integrated it as part of their treatment guidelines. So it's really important to see this. Now let's look at the impact and how this is affecting stigma. I think it's really important for us to recognize that stigma is still here. There's a lot of research about how bad stigma is in this field. People are really suffering. And here's some recent research that shows it's pretty shocking how severe the stigma still is in the public and the perceptions of people with HIV. So here's a study from Terence Higgins Trust in the UK showing 38% of people were uncomfortable just going on a date with someone who is positive, and nearly 50% would be uncomfortable kissing someone who is positive. This is a study from GLAAD in the United States showing that 59% of people said that it's important just to be careful being around people with HIV, and half would feel uncomfortable having a spouse or a partner living with HIV. Here's a study that we did called Owning HIV that was also really shocking because we were looking at young folks and we thought that young people in the United States would be more open-minded, perhaps. But we found out that they really weren't being well informed about HIV in the United States. And 28% have said they've avoided hugging, talking to, or even being friends with someone who has HIV. 30% said they would prefer not to interact socially with someone with HIV. These are young adults in the United States. This is shocking. This is really disturbing. But U equals U is working. The data is showing that it is working. Women living with HIV, a study from the Well Project in the United States showed that 72% felt that it had a significant or tremendously positive impact on their lives. A study by Jonathan Randina showed that in the United States showed that 82% made them feel at least a little bit better, and 80%, close to 80%, said that it would have a positive impact on societal stigma, the perceptions of people with HIV. And in South Africa, a recent study shows that it is reducing anxiety associated with testing and the stigma associated with testing for HIV. More people, men in South Africa, were coming in to get tested for HIV when they learned U equals U in advance. So that's really exciting. So this is what some of the data is showing, and there's more and more data coming out, but at this point, there's not that much on how is U equals U impacting stigma. We have a lot of research on how bad stigma is. So what we want to see is more research on what works and to go deeper into solutions. But I really love listening to the voices of people living with HIV because this is where we know that it is really helping people from all parts of the world. Cheryl from the Seychelles says that she's ready to break free and live and love without fear of discrimination. She's so excited and enthusiastic about this and has so much to look forward to in life because of U equals U. Similarly, Catherine from Zambia says she has a more positive feeling about herself. She doesn't feel like a danger to anyone. That's what we hear so often, is that people feel dangerous to the people that they love or want to have sex with or have a child with. They feel dangerous. Now we don't feel dangerous anymore. And Pete in Thailand, in his words, says that U equals U brought light in his darkest hours, and he keeps learning about it and feeling better about his life, and it makes him feel more valuable. And Daniel in Colombia, he kept hearing, as I did in the early days of this campaign, that U equals U just reduces or undetectable viral load makes it a smaller risk, transmission risk, or there's still a little bit of risk, and that's a heavy load to bear. But learning that there's no risk when you're undetectable and you're on treatment, that changes everything for us. That's why it's so important to be clear in our messaging. And Claire, who is from Rwanda and living in the United States, her babies are her U equals U babies. She conceived 2 children with her partner after she learned about U equals U. That's such a beautiful thing. Also, a really important, probably the most important study of this campaign recently came out called Positive Perspectives Wave 2. Really important study from ViiV Healthcare. I was very fortunate to be involved with it. One of the largest patient-reported outcome studies to date showed that when people with HIV were informed by their healthcare providers about U equals U, they were reporting significantly greater sexual health, mental health, overall health, viral suppression, comfort sharing their status, and adherence. So this shows how it's important for healthcare providers to inform people living with HIV because of the positive personal outcomes that can really be effective and change tremendously by hearing about this message. So it's important for everyone who interacts with people living with HIV to share this message. It's important for our health, and it's also important for public health, because the more people with HIV who are on treatment and healthy, the fewer new transmissions there'll be, and that'll get us closer to ending the epidemic. So together, let's work towards ending HIV stigma and discrimination. And here are 3 ways that everyone who's on this webinar today and beyond can help take a part in this and really change what it means to live and love with HIV around the world. First, we need to integrate U equals U into policies, the guidelines, laws like criminalization laws, and communications. And I just showed some great examples from Brazil, the United States, and Japan about how country guidelines are changing to incorporate U equals U. People need to hear from the very top so that they have the comfort and the credibility to share U equals U. It's still new information. It's still scary for a lot of people to share this news because it's so radical from what we've known for decades about transmission and people with HIV. So it's important to hear it from the top. And second, we need to have opportunities to educate and to talk about U equals U among healthcares and all professionals, and also in the community like we're doing today. So again, a big shout out to Virology Education for having this today, encouraging this discussion, and for everyone who's listening now, because this is how we're going to end stigma and discrimination, by talking about U equals U, training people how to talk about it, and continuing that dialogue in the field and in the community. And finally, to promote U equals U and all of your health communications with people in the field and outside the field. And we have to be clear. We have to be very clear in our language. We have to be consistent. We got to repeat the messaging over and over again. Because it's new, it takes a bit of time for it to be accepted by folks. So we got to keep repeating the message in different ways and make sure that it's conscious and it's authentic in the communication and adaptable to local contexts. Like we saw in Venezuela with the Guararo tribe, the oldest indigenous tribe in Venezuela, has a M equals M program. So it needs to be culturally adapted and sensitive, that not all people can get to an undetectable viral load, and we need to use U equals U to lift everyone up, to make sure that we all have the option to get the treatment, the care, and the services that we need to benefit from U equals U. That will improve our lives and reduce new transmissions, bringing us closer to the end of the epidemic. So a big thank you to everyone who's here today. Again, to Virology Education, to the sponsor Vive Healthcare, has been tremendous at sponsoring these kinds of educational opportunities, research, and programs around the world. And a major shout out to all the organizations in Latin America that are committed to making the U equals U, the I equals I, the M equals M, or message widely known. These are just a few of the examples. There's so many more. I know you'll hear more about them today. Thank you so much for listening. We really appreciate you being committed to sharing this message. We are changing what it means to live and love with HIV around the world. Thank you.